This is a brief presentation over some of the materials in Chapter 1. We're talking about directional terminology here, and these are some important materials that you will be using through the rest of your careers. Every field of study has its own language, and it's important to learn that language. As long as you understand the language, you're already halfway there. But if you don't understand the terminology, you will never understand the materials. Now, in anatomy, we use special terminology that is intended to prevent misunderstanding. If you are in a healthcare field and you need to speak to a clinician, you need to be able to describe accurately what's going on. So we have some exact terms that are used for position, direction, different regions of the body, and different structures that exist in those regions. The first thing we begin with is something called the anatomical position. And you have to visualize your patient in this position, because that's what everybody else is viewing your patient from mentally. It doesn't matter if your patient is laying down, sitting up, curled in the fetal position. The fact is that when you are describing them, you're going to describe them as if they were in this position. This anatomical position then is a standard position used when describing directional terms. In class, in lab, I am always referring to this position when I talk about something. Now, the position is that a person is standing upright, facing the observer. Their head is level, eyes facing forward. That means basically that the head is not turned to either side. The feet are flat on the floor. The arms are at the sides. And this is one aspect of it which is a little unusual. It's not a comfortable position, but the palms are turned forward. Generally speaking, at rest, our palms are toward our thighs. So you do need to remember that in the anatomical position, the palms are turned forward, as you see here. And that means that the thumb is toward the outside. In other areas of study, you will learn some other positions. There are a lot of them. These two are probably the most common you'll run across. There is prone, which is lying face down. And then there is supine, which is laying face up. There's also positions like the Trendelenburg position, which is a supine position with your feet raised, and so on and so forth. Directional terms. We have several terms that say further away from the head, closer to the head, further down an arm, so on. So let's take a look. Superior and inferior. These are terms that relate to the torso, the head, and the neck. And superior is moving toward the head. Inferior is moving away from the head. Medial and lateral, this is what is closer to the midline. If it is medial, it is closer to the midline. If it is lateral, it is further away. We have proximal and distal, which is different than superior and inferior. Proximal and distal relate strictly to the limbs, that is, the arms and the legs. When we talk about something on the arms and the legs, whatever is closer to the torso is proximal. Whatever further is distal. Now, keep in mind, this is a good test question to make sure that you understand the difference between proximal and distal, and inferior and superior. It's very easy to get those confused. Just keep in mind that when we're talking about a limb, we're talking proximal and distal. So in this case, what I would say is that the wrist is distal to the elbow, but the elbow is proximal to the wrist. When you see a question like that on a test, be sure that you read it thoroughly and understand it's very easy to get those reversed, and I see it all the time. We also have dorsal and ventral, which relates to front and back. Now, when I think dorsal, I think the dorsal fin on a shark. When I think ventral, I think of a V-necked t-shirt. Now, these terms are also consistent or interchangeable with anterior and posterior. So, just to reiterate, superior is toward the head. And if we're talking about the head itself, the eyes are superior to the mouth. So we should say superior is toward the top of the head. Inferior is away from the head. So the stomach is inferior to the heart. The chin is inferior to the nose, as another example. We have medial and lateral, nearer the midline, further from the midline. So the heart lies medial to the lungs. Further, in the anatomic position, keep that in mind, and this is a very good question, the thumb is on the lateral side of the hand. Proximal, in nearer to the attachment of the limb to the trunk, so the knee is proximal to the ankle. By the same token, the ankle is distal to the knee. Distal is further from the attachment of the limb to the trunk, so the wrist is distal to the elbow, but once again, the elbow is proximal to the wrist. Keep in mind that we are talking about things in relationship to one another and in relationship to a third item, which is the torso of the body. So you have to think of those three things relative to one another. Dorsal or posterior. At the back of the body, that is dorsal. The brain is posterior to the forehead then. The spine is on the posterior part of the back, or dorsal part. Ventral or anterior is at the front of the body, so the sternum is anterior to the heart. The nose is anterior to the back of the head. Now, in your textbook, you will find these regional landmarks. There is a page that has this picture. If you go to the virtual website, you will also see a similar image, or you will see a little ugly baby with all sorts of labels on it. And it has more labels than what you need to know. The terms I want you to be able to identify are these. I'm not going to go through and name all of them. I would want you to understand that when we're talking about nasal, we're talking about the nose, as an example. When we're talking sternal, we're talking about the middle of the thoracic. When we're talking axillary, we're talking armpit. This is just rote memorization, and I'm just going to let you guys go through it on your own. The same thing with the posterior body landmarks. I'm not going to hit on those, but understand that there will be a couple of questions on the test where I ask what is the appropriate term, for instance, if I am talking about the lower part of the back. What is the appropriate term if I'm talking about the neck? Okay. There are some other terms for body planes and sections. The term anatomy comes from the term cutting up. A tome is a knife. And there are different ways that you would cut. What we're talking about, you need to know these terms if you were going into surgical technology or x-ray technology, because these terms are used quite often. A sagittal section is one that divides the body or organ into right and left parts from top to bottom and front to back. A median or mid-sagittal section divides the body into equal left and right parts. A frontal or coronal section, and I'm going to use frontal much more than I would use coronal, but that section divides the body or organ into anterior and posterior parts. And then there is a transverse, a cross-section that divides the body or organ into superior and inferior parts. If you take a look at this graphic, what you see is planes that divide this young woman. We have a median or mid-sagittal plane, we have a frontal plane, and we have a transverse plane. In this particular image, what we have is, let me adjust that a little bit, what we have is the same concept demonstrated on an organ. We have the brain, and we see a transverse plane, which would cut the top of the brain. And so if you watched the movie Hannibal, when he cut the top of the man's skull off and started spoon feeding him brains, that was a transverse plane. There is a frontal plane, which separates the front from the back. And a mid-sagittal plane. Aside from ways that we cut the body up, we also have certain body cavities. We have the dorsal cavity. Remember, dorsal is posterior or back, so we have the dorsal cavity, which contains the brain and the spinal cord. It is divided into then two cavities: the cranial cavity, which holds the brain, and the spinal cavity, which holds the spinal cord. We also have a ventral cavity, which contains two major cavities. We have the thoracic and the abdominopelvic, and within the thoracic cavity we have the mediastinum, which contains the heart, and two pleural cavities, which contain the lungs. Below the diaphragm, and I should say that the thoracic cavity is defined by the diaphragm and the rib cage. Below the diaphragm, in the ventral cavity, we have the abdominopelvic. Now, it does consist of two cavities, which are the abdominal and the pelvic, but unlike the separation from the thoracic cavity to the abdominal cavity, which has a physical structure that separates them, the difference between the abdominal cavity and the pelvic cavity is more just geography. It is one open continuous cavity. It's just that below a certain point on the pelvis, we begin to consider that the pelvic cavity. The dorsal cavity then, just to reiterate, contains the cranial and spinal cavities. The ventral cavity has the thoracic and abdominopelvic. The abdominopelvic is separated from the thoracic by the diaphragm, and so the abdominopelvic is inferior to the thoracic cavity. The thoracic cavity, if you were to take the lung and heart out, would look something like this. With the lungs and heart in, you can see the mediastinum, containing the heart, and the pleural cavities, which hold the lungs. In describing what's going on with a person, we have a lot of people who have aches and pains in the abdominopelvic area, and it's a large area, so we have to be able to isolate where a problem is. Now, you can go upper left, upper right, lower left, lower right. I actually consider that just a little too simple and not precise enough. So what I like are these abdominopelvic regions. It's a tic-tac-toe board of 9 of them. And on a test question, I would not ask you what organ lies under this region or that region, but I would ask you to understand where the regions are and the relationships between the regions. So this is a question that combines two bits of knowledge, because I'm going to describe a situation. I'm going to start somewhere. Let's say I started in the right iliac, and I said I am in the right iliac, and I go 2 regions up and medially by 1. Where am I? And you should be able to tell me that I'm now in the epigastric region. So you need to know both directional terminology and the names of all these regions. I always start mentally with the umbilical, and then the left and right lumbar are named for that lumbar curve in your back. The iliac, you can think of the iliac crests for those, and hypo, meaning below, so this is below the stomach area. Epigastric, the stomach lies right in here, and epi is over or near or around. And then we have the right and left hypochondriac regions. Now, I know we've heard the term hypochondriac all our lives, and associate that with people who whine and complain. The fact is, though, that under these regions, we have some organs that can give us a significant amount of pain. We have the liver here. We have the gallbladder right in there. We have a flexure, curvature of the intestinal tract here that can sometimes develop a blockage. We have the pancreas kind of over in this area. So a number of things that could hurt. So doctors hate to say that they don't know something, so I think ultimately the term hypochondriac became associated with people who whined. Now, we also have different medical imaging. We don't have to cut people open anymore to see things. When I was a kid, there was a term, exploratory surgery. When you couldn't identify what was happening, you would take someone into surgery, cut them open, and find out. But now we have lots of visualization techniques. We do have X-rays, CT scans, ultrasounds, MRIs, and PET scans. I'm just going to tell you a little bit about each of these. First off, conventional radiography is great for identifying problems with bones, for finding hard substances, but radiation passes right through soft tissues, so we can't see a lot of detail. Also, because of the nature of it, and we're on film, we end up with a 2-dimensional rather than 3-dimensional image. A CT scan, we have an X-ray beam. We have considerably lower radiation, by the way, but by moving the beam, we are able to develop a video that shows a cross-section. Because we are hitting from several different angles, we also can get a fairly good view of some soft tissues. This is very good for finding kidney stones and gallstones, and ultimately what happens is the computer takes all of this and builds us a 3D image. Ultrasounds are great. They are non-invasive, and so they are just perfect for visualizing things with pregnant women without putting a baby at risk. All we're talking about are sound waves, and it gives a pretty good view of soft tissues. It is safe, non-invasive, painless. You get the image displayed on a computer, and now images can be quite detailed. You can make out forehead, eyes, hands, and other structures. An MRI, and we've all heard of those. What happens here is we put someone in a strong magnetic field, and it reorients the protons in water molecules, and then we expose that to just a little radio wave which will knock briefly the proton out of that alignment. In the result, it will release a little bit of energy that can be picked up and make a very detailed image with lots of soft tissue that you can visualize. Now, this can't be used on a patient with metal, any kind of ferrous metal, any magnetic metal. It is a very strong magnet. I occasionally watch this show, 1,000 Ways to Die, and in one episode, a man was trying to rob a doctor's office for drugs. And he had a gun, and the nurse took him into the MRI room and flipped on the machine with the expectation that it was going to pull the gun out of his hand. One thing she wasn't aware of is that he also had a metal plate in his head. And so not only did the gun come out of his hand, but he also flew across the room and crashed into the machine. There's also the PET scan. And what you do there is you get charged particles and you put it in a person's bloodstream, and it gives you a good view of blood flow to different areas. Now, in this situation, here is a brain. There's no blood flow to that particular tissue, so this person has had a stroke. So, the key questions that you need to be able to answer from this section, you need to be able to describe the anatomical position, need to know the major body cavities and what they contain, what plane would separate the different parts of the body from right and left, top and bottom, front and back. Understand what techniques are used for visualization. Now, these are some sample questions. I could ask questions not just about sound waves, but I could talk about x-rays, other things like that. So, this presentation is related to the notes pages and the materials in your textbook. This is a condensed version of what's in your text. Again, you need to memorize the regional terminology yourself, so this is not intended to replace your text, but hopefully it has helped. Thank you.